Hey everyone, and welcome to Holding the Line with Got Your Six Counseling. I'm Peggy, and this is Brittany. This is a space where we get real about the shit nobody wants to talk about: mental health, life, trauma, healing, and everything in between. Sometimes we get clinical, sometimes we get messy, but it's always honest. Quick reminder, this podcast isn't therapy, and it's not a substitute for professional care. We're not here to provide therapy, diagnose, or treat. If you're struggling with mental health, please reach out to a licensed provider. You don't have to go through it alone. We've got your six. We're just two trauma therapists showing up as humans first, ready to have real, unfiltered conversations about the stuff that matters. We're here to break the stigma, share what we've learned from both sides of the therapy room, and talk about the challenges people face every day, especially in the veteran and first responder communities. Whether it's trauma, burnout, relationships, identity, or just getting through the week, we believe that these conversations matter. They deserve space, and that's what we're holding the line for. So let's dive
in. Hello, and welcome back to another episode of Holding the Line with Got Your Six. This is episode 12. Oh, I wrote it down. 12. It's episode 12. Sorry, don't fire me. I'm so sorry. Today's title is Tiny Humans, Play Therapy is Therapy. We're going to be talking about play therapy with children. I guess I'm going to be talking about it, but Peggy's going to be asking lots of questions and guiding our conversation because that's her job. She is the brain of this operation. I have the ideas and she brings them to fruition. So tiny humans need therapy too, and not a lot of therapists do play therapy. Actually, what you'll find is not a lot of therapists
do tiny humans
at all. Like, you'll see their profile that says they only see people like 16 and up or 18 and up. Mostly it's 18 and up. Yeah. Well, your telehealth, that's different. It's hard to work with teenagers telehealth because they're like, I don't want people listening. Or they just don't engage with you at all. They're just like looking at you across, your computer screen. Play therapy, I don't know how I could ever do that telehealth. So I do see kids. Most of us do that are in person. Peggy does not. Chastity doesn't. But anyways, I'm not getting on my soapbox about that. I do know some therapists that do play therapy telehealth, and I'm like, but how? Okay. Anyways. So let's get into it.
Okay, since I have more questions about this because I don't do tiny humans, I'm going to ask the questions here and let you answer because I don't know what this is actually.
Feels like a Q&A.
Exactly, because...
Am I the special guest today?
You are the special guest. Because what is play therapy?
Play therapy is an evidence-based treatment. It's not just like frou-frou stuff that we do. We use play in like the natural environment, right, to give them a safe space to process feelings, which sounds very much like I just made that up, but it's true. It gives kids the ability to be autonomous, which is basically like make their own choices. And then we use co-regulation, which I think is something that we're getting into in a few bullets here. We use all of that to help them work through the issues that they're having. However, kids aren't going to talk about their issues like an adult would because play is their language.
Okay, but what isn't play therapy? Because like I know parents will come in very like it just looks like you're playing with action figures or in the sand tray and stuff like that. And like they have like a very, I guess, one-sided opinion about what their therapy is supposed to look like. So what isn't play therapy versus like, you just gave us a good definition of what it is. What isn't?
I just lost your, there you go. I mean, I would say play therapy isn't. What play therapy isn't? A play therapy can be anything that we want it to be, right? You said playing with action figures, playing in the sand. If we're coloring, if we're playing with slime, if I'm playing with air dry clay, or we're playing with Legos, or we're playing Uno, play therapy is anything that we want it to be that is going to help them work through something. parents have a hard time conceptualizing that because all they see is the chaos, all they see is the play and not the stuff that we're doing behind the scenes, right? Their internal experiences, because they have no awareness of this emotion or that emotion, they can't express it the way we do. They don't know what it feels like to be sad, which, like, you know, for kids especially, they're like, oh, my kid is so angry, he's so irritable, like, all the time. They think that their kid is just a problem child. Really, that kid is probably just depressed. They don't know how to, like, voice that or say that or externalize it anyway, so they internalize it. Mm-hmm. When we're playing, they can externalize that in a way that is much more simpler for them. And then we, as the therapist, are observing that. We're seeing themes, like, emerge, right? And usually you're surprised by it, you know, unless you know at intake, the parents are telling you that their kid is this awful child, right? Or they're super anxious child, but in the therapy room with you, they are a totally different human being because they have one-on-one attention with you. You're doing something with them that they enjoy doing, right? And you're just talking. There's no pressure. I don't want to say there really isn't anything that isn't play therapy. If you're play therapy trained and you know how to, like, cater this intervention or this activity into something that's going to work for that person, then I would say that you could always use that as a tool, right? Like, I had a kid, one of my very first little ones as a resident, so impulsive, ADHD into space, right? But also had lots of other behavioral issues. And he would run into my office like, what is that, where they run like this? I think it's like Naruto run. Mm-hmm. Literally, from the waiting room into my office all the way back. So we would roll like a ball from one end of my office to the other. And the goal was to not hit the wall or the door. Because most kids want to just slam it. Okay. Right? We're going to roll it really, really slowly. We want it to get all the way over there, but we don't want it to touch the door. And that seems silly to people when you explain it. But that's impulse control, right? Because we want to learn how to control it. We want to learn how to control the ball and control our impulse. And just because he would just launch it, right? Like, no, we got to do it very slowly, right? So something as simple as that, most people would be like, that's not therapy, but it is. Okay. Because we're learning to control the impulse.
All right, so is that how we're integrating more of, like, what we would consider modalities and stuff like that into play?
Yes and no. So there's lots of modalities. If you're familiar with therapy, you know, you've got like a CBT, all the different. When it comes to play therapy, depending on your therapist, that kind of goes out the window. Mm-hmm. So there's really just like the child-centered and the what's integrative or structured, right? As a therapist, you kind of have to make the decision which one you're going to do, right? Child-centered is what most people do, which basically means that they have the freedom to choose whatever activity we're going to do. You know, they come in the door and you're like, what are we going to do today? You know, that gives them the ability to self-regulate whatever's happening. They talk about whatever they talk about. You might guide the conversation a little bit. They say something, you're like, oh, tell me more about that, right? The structured is more if they're really impulsive, they have some severe behavior issues, or if we're looking at some more like trauma-related things, which we're going to get into later, that you have to step in and regulate for them. So child-centered, they're doing their own thing, they're being autonomous, they're choosing, oh, I want to play with slime, or can we play with Uno? Or we play slime, and then they're like, I'm all done. Can we play Uno now? And now there's like glitter and foam balls, and you're like, all right, cool. The other good thing about that, too, is that they are like, oh, I'm so sorry for making a mess. And you're like, no, it's great. And some kids don't even care, right? Like, but we're making a mess. That's what we're here to do. And then you have to spend 20 minutes cleaning up the mess. Okay. But that's the point.
So what happens when we do get a child that comes in with trauma?
That's the fun part in a good way, right? Mm-hmm. The kids that come in with trauma, typically the parents already know to some degree, but they don't realize the impact the trauma is having on their kid, right? You and I know what trauma looks like in adults, but it looks very different in children. Because they will go back to earlier stages of development. They have a lot of somatic plaints, which is usually kind of like the first signs that like they're probably developing some PTSD. Some kids will move through it fine, right? Like maybe they need therapy, maybe a little bit of play therapy will kind of move them in the other direction. The opposite of that is when kids come into play therapy and they start exhibiting what we call post-traumatic play, which not all, I'm going to say not all, but if you're familiar with it, we're doing it, right? It is something that once you see, you can't unsee. And you're just seeing those patterns. So post-traumatic play is completely devoid of pleasure, right? These kids come in. Most kids love therapy when they're doing play therapy. They're very excited about it. They love to come in and play with slime and do the sand tray or whatever. It is, they come in and they don't want to do it. They're going to do it because they know they have to, but it's devoid of pleasure. It doesn't produce usual gains or progress like regular therapy does in resolving whatever they're coming in to fix, right? They still have anxiety. They still can't sleep. They still can't do this. They still can't do that because they're stuck in that hole, right? There's different types of play that they can exhibit in post-traumatic play, which is far too complex for the time we have in this podcast. If you're a therapist, there's a book about it. Read it. It's great. But the goal in post-traumatic play, the hard part is to determine as a therapist when you have to step in and take over because their play becomes very repetitive. It can re-traumatize them if you don't step in. They will get you to engage with them in their little repetitive behaviors and reenactments of their trauma, which makes it really hard not to because that actually makes it worse. So they try to externalize the things, and that's the goal, right? We want them to externalize what happened and work through it, which is where some of the other interventions come in, like the sand tray or EMDR with the sand tray, depending on their age.
All right. And then, I think I get this even with, like, my teenagers, some is, like, the expectations when it comes to, like, the parent and the kiddo, right?
This is a hard one. And a lot of parents get upset about this because you've seen minors.
Yes.
Right?
Yeah.
So in terms of like working with a minor child and the parent, people get in their feelings about some of our rules and boundaries. And I always tell students and other people, and they ask me, and I'm like, you got to lay down the law very early on, right? So I want to start this, the confidentiality, right? I tell people this in the beginning. Your kid is my patient, not you. Right? Like, I am their advocate. This is how this is going to work.
And it almost takes them, like, aback. Like, they're like,
right,
whoa.
because they're very shocked by that, right? I think that they are in this place of, like, we're going to do this therapy thing, and I'm going to be very involved in this process. And it is 100% fine for you to be involved in the process. But what we're not going to do is now have you, knowing all of the details of our sessions because, we go through informed consent and we're like suicidal, homicidal, hurting them or hurting someone else, whatever. That is when I'm going to reach out to you. And even then, I'm not going to go behind their back because our trust is so important. Like with our population, it's already important, but when it comes to kids,
even more.
It's just as even more. Because if you are not, what am I trying to say? Not trustworthy in a kid's eyes, in a teenager too. Oh, absolutely not.
Especially when
you're done.
Especially when mom and dad like to sit there and spout off emails to us and be like, "I need you to fix X, Y, and Z."
Yes.
Pump the brakes because that's not what we're here for.
Yeah. No. And so I fine. You want to send me emails about what's happening at home? I'm fine with that. But the other thing I explain is whatever you send me in an email, I'm going to tell your kid about because now I have knowledge of something that happened that they don't know that I know. And so if I bring it up and they're like, well, how'd you know about that? Right? So they come in immediately. I'm like, hey, so your mom sent me an email. Do you know what it's about? And they're like, oh yeah, it's probably about blah, blah, blah. I'm like, yeah, that's exactly what it was about. Because in no way, shape, or form do I ever want that kid to believe that I'm trying to go behind their back and have conversations with their parents about something. Also, The time to have conversations with us about your kid is not before their session or during it or after it. You want to have a conversation with me, we can schedule that. Because you're monopolizing their time, right? They'll stop you in the waiting room. If it's a very short conversation, fine, 1 to 2 minutes. But when we're out there talking or you step into my office and take 15 minutes from your kid's session, now we don't have a full session to do anything, right? So that's the other thing. Confidentiality speaking, we're not going to talk to you about anything that's happening in here unless they tell us we can, or they want to hurt themselves, somebody else, someone is hurting them.
Because consent with the child, I believe, is a very big thing. We want their permission. We want them to have that trust, and we want them to have the autonomy in making those decisions. Exactly.
So, that I always say, a perfect example, maybe they're cutting, maybe they feel suicidal, maybe they said they want to stab somebody at school. And I'm like, so I think we should maybe bring mom or dad in here and have a conversation about what we just talked about. Are you cool with that? And even then, when mom or dad step into the room, I am not the one telling them. They are. I need to empower them to talk about what's happening with them. So I'm not the one. I don't want to be the one that betrays them, because sometimes you do have to betray people in order to keep them alive and safe. That's different. I want to empower you to do this thing with your parent. But I'm not going to give you updates on what's happening unless we're doing a treatment plan review, which is a reason why you might be involved in the session.
Yeah.
Or we're changing a diagnosis, updating, or maybe they've met criteria for something else to add or to change.
Yeah, because we want to get input on treatment plans and stuff like that. Hey, what progress are we seeing? Right. Where are we still struggling? How can we help with that? What skills can we actually help you with at home to better aid the child?
Yeah. So, it's sometimes I will ask the child for, depending on their age, obviously, right? This is age appropriate. Depending on their age, I will say, hey, you've been seeing me for a while now. What do you think? Let's update your goals. Is it okay if we get your mom or dad in here and talk to them about it too, right? But I'm not telling them what their kid just told me. I just want their input, right? Get their input. And then, my treatment plan reflects that I talk to the patient about it, I talk to the mom about it, or the dad, or whoever, and then we update this treatment plan, right?
And then assisting the parents, especially, like, okay, do you need that session to, like, get psychoeducation, to assist in learning skills and things, to aid them?
Right. And, that, I think we touch on that later about the different interventions that we would involve the parent, right? Like, there are some where, and some therapists actually do this, like, they swear by it. Psychoed is super important, and I think I've done that with a couple. I will meet with parents alone. I actually prefer it. But I don't do that unless their kid gives me permission.
Exactly.
I'm not going to be like, hey, I'm meeting with your dad next week or your mom next week. I say, hey, I would really love to meet with your mom or your dad without you here. Remember, though, I can't tell them anything that we talk about in here. The only thing we're going to be talking about is maybe your diagnosis, like, the stuff I have you diagnosed with, depending on their age, because some don't understand that. Maybe I just want to know more about what happened when you were a baby, or between your mom and your dad, or this or that, right?
Yeah.
They're just telling me things. Some are comfortable with it, some are fine. Some are like, absolutely not. And I'm like, okay, maybe we can talk more about it. Some meet with me with their kid. That's fine too. Some do that regularly. So it really just depends on what their preference is, but I would never do that without their permission because, again, the autonomy part of that. But I don't know that I've ever had someone step in just to observe the play because it disrupts the environment that we've created that is now their safe space being autonomous, because now they're looking back at mom or dad or grandma or grandpa instead of me being the person in the room that they're looking to for direction, and, like, I don't want to say guidance, but I'm that safe person while we're in there. And now they're looking back to that other person instead. So it kind of disrupts the whole thing.
Okay, so what do we do when we got these parents, but you're just playing? How is this helping?
That statement vexes me so much. And some get it, right? Like I'll even say it out loud to them, and they're like, no, it's I definitely see progress. They're like, you're just playing. And I'm like, I know it looks like that from the outside. But the main thing that I'm doing is co-regulating with your kid. Like, that is the most important thing, because your kid doesn't know how to regulate themselves, and they're learning how to do that by being in there with me while I am regulated, which is like one of the most important things about doing play therapy, right? Is like the co-regulation piece that comes from that. That is like key. It's where we're modeling the calm, we're attuned emotionally, and we're helping them navigate that by like feeling it from us. Because I always explain it to parents as like, remember when your baby was a baby, like your little baby here was a baby child. Maybe you were nursing, maybe you weren't, but they were getting so upset. Like, they're crying, they're screaming, and you're a new mom, so you're already up here. And you're getting so frustrated, and you can't calm them down. Maybe you can't get them to nurse. And eventually someone comes along and they're like, you have to just calm down, because they can sense it that you're frustrated. That is regulation. That's co-regulation. If you are calm, they are calm. Same thing with dogs, right? Like, everyone that is around us can sense what we're feeling. So if they come in and I'm calm and I'm modeling that calm, then so can they. And then they go out and learn how to do that every time, right? Unless we're looking at post-traumatic play, that's different. But for regular therapy and the things that are happening, they model the calm and they go home and model that. And they learn how to control and regulate their emotions simply through that, but also through other techniques. That's different. So I'm very much explaining, like, the simple stuff they're learning, you don't see happening visually. It's this very, like, innate process that they're just learning. Also, they get 1 hour of time alone with someone who is solely focused on them, which gives them this safe space to talk about whatever they want to talk about, right? And that they feel safe to talk about these things that they otherwise wouldn't, in the same way that adults do. But it feels very different for kids, right? Because maybe they can't go home and say, I hate my teacher, or I hate school, or, right? Which feels very commonplace right now, right?
Yeah.
But we also provide the safety and the trust, right? Without fear. And then we build the internalization of them, again, being able to do that all the time. Now, does it last? Maybe. Depending on the parent's ability to regulate. If the parents aren't, you and I know this as kids with neurospicy kids, if we're not regulated,
they're not regulated.
We can't regulate them, right? Because that time I was like, maybe it was me. It probably was. Like, he was regulated until I wasn't, and now we're both here dysregulated besties, right?
Yeah.
And now we're not getting anything done, okay? So that's primarily what's happening, right? And I'm like, but you said your kid was getting better, and now you're mad that we're playing with slime. Are you just mad she's bringing home 10 things of slime every time, or what? We can stop.
More like it's getting into the couch and other places I would prefer not to be.
I always have a conversation with the kids. I'm like, listen, I know you love this slime, but like, if you're going to take this stuff home, we need to have some boundaries on what you're going to do with it when you get there. Your parents are already going to hate me because I'm sending slime home with you. So you're going to have to behave with this stuff when you get home.
Bet. No.
Yeah. I have some that like to take several containers at a time, and I have to start limiting it because they'll come out to the waiting room with like that one I had that left with like 10 containers of slime, and I was like,
I'm so sorry.
I did. I walked out into the waiting room, and I was like, I am so sorry. And the mom was like, it's okay, she loves it. And I was like, okay. Well.
Until you get that parent's like, I hate you. I hate therapy now.
Yeah. Although I've never had someone say that they prefer for their kid not to play with slime or whatever. So thankfully, because they really do love the slime. I do not know. I hate playing with slime. I do not know what it is about the slime that these kids just love so much.
Okay.
I like the clay.
Yes.
That's me.
Well, I mean, okay, so we have this post-traumatic play, and then it's something I have seen you do. I have seen pictures of it, and it is sand tray therapy. I find this absolutely fascinating, what is involved in it, seeing their tiny little worlds. I'm like, can I go play in the sand tray?
Adults play in the sand too. I put adults in the sand tray, and they're like, "Are you kidding me?" And I'm like, "No, get over there now." The teenagers are the only ones who will blatantly refuse. They're like, "I'm not a kid," and I'm like, "Okay."
Okay, so explain to me sand tray and how it works.
So the sand tray is a way that we can have kids express their inner world, right? And it's like this creative medium. It's not like, oh, color me a picture of your house and your family, right? Like this is a 3D view of this child's inner world. And sometimes people will let them do it freely, right? Like whatever they want to do. But generally there's a prompt, right? Like I'll say, build me a world of this or create me your world of that, right? And then it's very much like I'm not saying much until I observe something that I'm going to comment on. Because when they're in that world, they're in it, right? Like you'll see, like we were talking about that yesterday in group. That's where some kids will dissociate because they're in it, especially if there's trauma. If they're reliving that in that moment, they're gone, right? Like you might go to comment on something and then you're like, hello, right? That was the first time it happened to me. And I was like, oh my God, I broke this child. No, it was dissociating. But no, so it allows them to process things, and then we conceptualize the meaning afterwards, right? Okay. So there are different types of worlds that these kids can create that we kind of look for certain things to see what might be happening internally that they're not verbalizing. Like the one I always am looking for is, like, without getting too much into it, is if there's no people in it.
Okay. What is...
Like we call it...
Yeah.
It's called an empty world. Well, an empty world has like less than a certain amount of items, and then there's no people in it. That's concerning, right? Like you would think if I said, Peggy, build me, this, like your favorite memory or this or that or whatever, right? You would have people in it, or a safe place, or a place that makes you happy. There's probably going to be you and your husband at the very least, right? Some kids don't put any people in at all, which usually means that they feel unhappy. They feel like they don't trust people, right? Like it's a very untrusting, vulnerable situation these kids get put in. Okay. Maybe they're depressed. So it kind of gives you like this internal image of what's happening with them that you can use for later. But watching them build a sand tray and then afterwards you take the photo and you're like you don't want to, there's a very fine line, right? Like you don't want to overanalyze, but you're like, I see what you did there, right? Because then when you ask them about it, you're like, I see you put that lion in the middle of the ocean. What's going on there? And they're like, I don't know, right? Like most of the time they have no idea why they're doing what they're doing, but their brain is like driving this inner world for them that they're creating. And they're like, I'm all done, right? And some of it's just chaotic. Some of them show some really like crazy aggression, like fight scenes and people attacking people, or very closed off, fenced worlds. Like I had one that completely did like the sand tray with all these fences. So it's really wild to see what kids will put in the sand tray that allows them to be creative and also express their emotions in this external way. When you pair it with EMDR.
Yeah, I was about to say, throw some tappers on and what happens?
Yeah. They get very activated in a way that, like, maybe activated is not the right word. I always say activated, but maybe that's not the right word. If I put the tappers on them, I should have brought them over here so I could show, but they're like wristbands, and it looks like a watch, essentially, for both arms. I love them. They're great. I waited a year for them to come back in stock. But I'll put them on. I control it with my phone, so I put them in the sand tray, and they buzz, opposite sides. That allows both sides of their brains to stay online, just like regular EMDR. And then I give them some very basic EMDR-related memory type goal to build. They get very, very, like, fidgety. Okay. They start opening all my drawers. get like upset about, they're like, I can't find this,
Yeah.
right? And then, so, but what it does, it allows them to then do the same thing that we would do in regular EMDR, right? In a very more, like, I say very, in a more grounded way than we would if we were trying to get them to do traditional EMDR.
So does EMDR for a child go quicker, or how does that work necessarily for a child versus the adult? Just because like their memory is, well, their memories are shorter technically.
Yeah, so I guess everybody does it differently. Like I never got to fully see Christina do like a full round on a child, but like the way that her and I have worked on it and the way that I've done it so far is like, I have a workbook, I have sheets. Like if we're going to do it, we kind of work through and try to find the memories that they have and kind of go through it that way. Generally speaking, I'm throwing tappers on them and putting them in the sand tray, and we're trying to work through things in that sort of way. Kids are usually pretty resistant to delving into trauma memories or trying to reprocess anything because it's very uncomfortable. They are even worse than adults, which is why they subconsciously reenact the trauma in play, which is where the post-traumatic play comes out, right? So that's where you see it, where it's everything's literal. You see that in the sand tray too, right? Everything is very literal. Yeah. Everything is repetitive, right? Like you put a kid with trauma in the sand tray, most of the time, if the prompt is similar, they will build you the same world over and over and over again. And that's when you're like, here, put these on, right? It's cool. You want to be repetitive and literal about it. We're going to put some tappers on you and do some BLS while you're in the sand tray to see if we can push you through that little hump you're stuck on, right? So I don't know that it takes any longer, if it's any longer or shorter, because some adults vary too. Yeah. And then some kids eventually are like, I don't want to wear those anymore. And then they get very, very sassy about it. They're like, I don't like the way those feel. I don't want to wear those. And then some will completely refuse to do the sand tray anymore, too, because they remember how uncomfortable it is. Yeah. So it's just navigating through that, too.
Okay. And then, like, we have all the common questions and the doubts that come from, like, the parents. Like, we have this, like, you need to fix my kid mentality, or, like, when are they going to be fixed? And, like, I see it from, the teenage perspective, from those parents. Yeah. Like, why isn't this working? Why aren't you done yet? Like, it's only been a month, and, like, I'm not seeing anything out of you. Or I'm not seeing anything out of them.
They didn't get like this overnight, is usually my response. So I'm not going to be able to fix them in 30, 60, 90 days, or even 6 months, depending on how long they're here, right? Also, I need that collaboration with you, because how often are the parents part of the problem? I own that, right? Like, I know that I'm the villain here when it comes to sometimes with my kids. I know that I'm part of the issue. If your child's therapist comes to you, or you're talking to the therapist and you're like, why is my child not better? And they're like, well, we're working on these things, but I also think it would be helpful if you went to therapy yourself, based on what I know. I think it would be very helpful. And you're like, I'm good. I don't need therapy.
Do you feel seen in that moment? Maybe. But also know it's for the benefit of your kiddo. Right.
Because whatever it is you've got going on, right? Like maybe you've got trauma. Maybe you don't. The real truth is that therapy, most likely, unless you get a crappy therapist, is not going to hurt you. And if it's going to benefit your child, why not?
Because just know that your 6-year-olds are absolutely ratting you out.
Yes. They are. It's like school. When your kids go to school and they tell the teacher all this rando information about stuff at home, they do the same thing here in a much more impactful way. And listen, we don't judge, okay? We're not judging. We just look at it like, would therapy for mom or dad also help? And usually the answer is yes. It's never no, because therapy is not going to hurt you, right? My job is not to fix your kid, right? My job is to help empower your child to regulate themselves and control their impulses or help move through like whatever anxiety is happening or be able to confront that stuff without being so distressed. I am not here to fix anybody, right? If you want somebody to fix them, I don't know who to send you to. So if you find somebody like that, let me know. Because I don't know that people fix anybody. But they used to do that with lobotomies, and we don't do that anymore. So we don't fix people anymore. We help them learn skills to decrease their distress about them. Okay,
and we can do that for you too.
Yes. So also, again, I'm going to read that. You should also go to therapy too. Okay. I just want to put that out there.
Because talk therapy is adult therapy, and that's a good thing. And play therapy is kiddo therapy.
Right. And this, so maybe should have said this at the beginning, but when you said that, it triggered this, and maybe this is a good point to say it too. There are children who don't feel safe enough to play, right? And so play therapy gives them that outlet to do that, right? So if the kid has trauma, maybe they've been neglected, maybe they've been parentified, right? Depending on the age. And so being able to come to a play therapy setting where they are I don't say just child, but a child that can come and play at their developmental age, it allows them to play again. Because with adults, and they have their anhedonia, which is the fancy, beautiful word for not finding pleasure in your leisurely activities, kids just stop playing, right? Like you'll see a kid that doesn't want to play anymore. They're just, and not like they're playing on a tablet, right? Like they're not doing anything. That's how you know something's not right with the child that's not playing. So if they come into this room and they don't want to play at first, I'm like, that's fine. Eventually they feel safe enough to do that, because when you're in survival mode, you can't play. There's no time for that, right? So play therapy allows them to move from not being able to play or not feeling safe enough to play to being able to play. Okay.
And this is, and I guess it's because I have my own 2 tiny humans in therapy myself, and parents are known for this. Don't bug your child about what happened in therapy or what they talked about in therapy. It's their therapy, and if they want to talk about it with you, that's one thing, but don't sit there and probe them about it.
Yes. Yeah. I feel like adults do this too. When I'm done with my therapy, my husband's like, what'd you talk about in therapy? I'm like, mind your business. I think maybe that's a control thing. I don't know what that is about, but I haven't really run into a huge issue with that so far, because I do kind of put that into my little spiel in the beginning of our first session. And most kids these days are very empowered to be like, I don't want to talk about it, right? Or their favorite line, I don't remember. They'll literally probably walk from my office door to the parking lot, get in the car with their parent, and they're like, how was therapy? What did you guys talk about? And they're like, I don't remember. The same way they do with school, But yeah, I mean, giving your kid the space, to like, kids deserve space, right? Like that's all I'm going to say. They deserve the space, right? Like they're in therapy. You decided to put them in therapy. You were like, they need help. They need assistance. Mm-hmm. Give them the space. If there is an issue that we are concerned about, safety or otherwise, we will be letting you know. If there is an intervention that we have given them to work on that we need them to practice at home, we will let you know, because we need your support to help that continue to work and for them to solidify that intervention. Yeah. That gets more problematic with teenagers, but, with younger kids, it's usually much easier, right? Teenagers are like, I can't do that, They don't want to, so teenagers are a little bit harder. We're talking about play therapy and not so much teenagers, but yeah. Give your kids the space. We will talk to you if we need to. Yeah. Aside from that, bring them, drop them off. Let's do our thing. And go for it. All
right, so from the therapist perspective, what we're getting out of play therapy with our tiny humans. Because we're getting these insights to their emotions. How do you actually observe that? Like, how do you tell when they're dysregulated, when they're like, when they go inside themselves, like when they shut down? How do you get these things out of the tiny humans?
So, gosh, I feel like there's so many things I should have brought over here as an example, but it depends on the kid in terms of trying to get them to engage. Most of them will just talk to you about, school and such like that, but what you're looking for in terms of like, say we're playing Uno and they lose, like we talked about in that famous video snapshot of our other one, right? They lose and they get very dysregulated and upset. Now we're kind of talking to them about being dysregulated and the things that opens the door, right, for the things that make them upset and how they get dysregulated and what happens then, because they're not very in tune with like their bodies and emotions and how they connect. When we're just sitting there playing, they get very resistant to things sometimes, like one that I'm seeing right now, and I'm trying to talk to her about stuff. It's very much like, I don't know, or I don't know how, or what, why, like it's very avoidant. So sometimes it's very challenging to navigate that, I don't want to say to make the session meaningful, but to feel like they got something out of it, aside from just playing with slime, right? So those are the times you get a little bit forky in yourself, like, well, we played with slime and I tried all these things, and also she was pretty sassy the whole time and refused to do the things that I was trying to get her to do that were guiding this. Some kids will show impulse. You set boundaries. They're running around. They're doing things you've asked them not to do. They exhibit anger when they're talking about things, but they can't express like, I am angry. They're angry. I have, I think I showed them in group one time, but I have a feeling chart that's developmentally appropriate for kids, and it's got all these faces on it, like the ones you see at the doctor when they're asking you your pain scale. And they're all different colors and stuff, and sometimes I'll ask them to look at that. Yeah. More recently, kids are into the inside out emotions. I have not seen the second movie. I know, shameful of me. I should, being someone who works with children in that way. But a lot of them are not even aware that like emotions are a thing until they saw Inside Out, and like how to even externalize that. So they've seen the movie, but they don't know how to do that. They're like, oh, well, what are some of them? Like the anxiety, the anger.
Believe me, I feel anxiety. Okay, she is my homegirl.
Yeah. I've been gaslit into believe that I am anxious as well. I still don't feel like that's true, but maybe anxiety is my homegirl too. I don't know. But a lot of them don't believe that like emotions are a real thing. So asking them to express that is hard. Instead, they just like externalize it in their behavior. So you'll see that, with like the running around or lashing out at you. One of the kids I saw, this was an example of his anger. We were playing with slime. This was the kid with the ball. He was rolling the ball. He would launch that ball around the room. And I mean, like, not like it was like, boom, right? One side of the room to the other. So I'm sitting on the floor. We're playing with slime. He's still kind of like randomly throwing the ball across the room. He got upset because he couldn't open something, it's been so long now, I can't remember. He picked up that ball and launched it across the room, and it bounced back and hit me right in the eye. And it was like not like the cool, cute, squishy stress balls. Okay, this is like the hard OG ones. And I was like, now we're looking at several things here. This is the regulation piece and all of it, because instantly, internally, I was like, right, like I was ready to just lose it. But also, I'm like, I can't react, because if I do, what is that going to do to him, right? So I was just like, I took a breath and I was like, can we not throw the ball at the wall anymore? But he completely shut down. Yeah. After it hit me, he was like, I feel like he became this big, right? Because at home, he probably would have got yelled and screamed at, spanked, who knows, right? Yeah. So you see both sides. You see the anger and the impulse, and then the immediate shutdown.
But that leads into like that all behavior as a form of communication, because like he gave you so much communication just in that little bit of time.
Yeah, getting hit in the eye was worth seeing that reaction, right? Because now I'm like, oh, I know what you were expecting me to do, which I didn't, And now you see that this is okay, right? Like, is it okay you hit me in the eye? No. Did I need to have this huge reaction to be like, oh my God? No. I was like, ow. He was like, are you okay? And I was like, I'm okay, but maybe we just throw the ball at the bottom of the wall instead of the top, so neither one of us gets hurt, right? And maybe at home the reaction is not the same.
Yeah.
So you get to see, they give you a lot in just a little bit, and I hope I answered that question because I feel like I'm talking in circles.
No, but we want the big thing is like takeaways, like for parents, that therapy is happening even if it just looks like play or it's chaos. Don't overanalyze it. Don't overanalyze what your kid is doing. There is therapy happening.
Yes. Yeah. Yep, it does. If a parent walked in here while we were doing play therapy, especially if we were doing slime and stuff, they would be like, they would probably be disturbed at like the mess in front of them, like, what is happening in here, right? I always joke, I'm like, do play therapy, they said it would be fun, they said, and then I like look at the floor and I'm like, but we had fun, right? Like that, the more chaotic the floor is and the more chaotic my office is, just shows how much fun we had. And I'm like, that was a good session, right? Like, we had a good time. If my office is clean after a play therapy session, then not enough happened. Because the more involved they get, the better.
Are you a weirdo and allow glitter in your office?
Yeah. Glitter is everywhere. Even still, like, I can vacuum. The only way I can really get it out is if I rip my office apart, and, like, I have to do that every other week. Like, rip it apart and vacuum and mop. Not a lot of them use the glitter, though. Most of them like these little tiny foam balls that are like that big, and they are just as hard to get up. Because when you push the vacuum near them, the air from the vacuum blows them away, and so you're like, come here, come here. Yeah, those are even worse than the glitter.
But parents, trust the process. Work with the therapist, not against the therapist. They're there for you.
We are. We want to hear from you, right? Like, you want to send me an email about what's going on? That's great. I love that. I'm here for you. I'm here for it. But also, I'm more here for your kid.
But also, let kids be kids. You know, they're going to get dysregulated. They're not little robots. And, like, what is developmentally appropriate?
Yes. And my soapbox on that is I think currently in our world right now, we put a lot of pressure on kids, teenagers especially, to be these very functioning, well-adjusted, regulated humans. And that is so far from reality. Because how many adults do you know that are that regulated and functioning? Because I'm not that way. Right? I mean, maybe I'm regulated most of the time. Maybe I'm functioning most of the time. But, like, if we can't expect every single adult to be that way, then we should not have to expect every child to be that way. They're children, right? Most of them are not even at the level emotionally, like developmentally emotionally, however way we're doing that now. I don't know why. It's Friday. I forgot what day it was. Words have been really hard this recording, and now I remember why, because it's Friday. They're not even at the right level emotionally in their developmental milestones, right? When I was looking at, they have the functional, emotional, developmental levels. I was looking at it yesterday, and I realized that, like, my daughter, like Kylie, is only on like step 5 or 6, so she should be way higher, right? And she's getting ready to be 9. She's also on the spectrum. That's totally different. But maybe your kid's not on the spectrum and they're still not where they should be.
But kids deserve validation, support, space, because being a tiny human is hard.
In this world, school is hard, right? School is hard. Life is hard. And as parents, we put a lot of pressure on our kids.
Exactly.
But they deserve your support.
Exactly.
They don't need to be invalidated because they're struggling. How can I help? What can I do? What do you need? It doesn't make you weak. This is the generation, this is the world we live in now. When we were kids, we weren't allowed to be like, I'm feeling this. I feel offended that you said blah, blah, blah. I wouldn't have teeth in my mouth if I said that to my parents. But we empower our children to share their emotions and speak them now. And it's so important that they know, because if they don't do it now, they will never be able to do it later. How many adults do you see currently that you've had to teach about emotional intelligence or show them a freaking emotion wheel and be like, tell me what you're feeling.
But it's okay to be a human too with your child, and like you get dysregulated, they get dysregulated. I mean, me and Lucas matched energies over the weekend, and that was a fun time because, you know, he's trying to do a paper and he doesn't want help, and then finally goes, Mom, I need help, but I'm smarter than you.
Like Landon with his driver's test. I was like, have you studied? Do you want to study together? And then he fails and he's like, we should have studied. And I was like, we should switch kids. Like, you take Sawyer and I'll take Lucas.
You deal with teenager and autism.
Maybe I do older autism better than baby autism.
I loved baby autism. It was awesome. Because this sucks. I don't like it. I don't want to be here.
If I don't have to scream black pole 50 million times while we're driving down the road, I feel like that's already a win.
Yeah, you take hormonal autism, and I will totally take tiny autism.
I feel like I do so much better with teenagers. Yeah, so let kids be kids, you know, especially if you have kids like Peggy and I have kids on the spectrum. I have a kid that doesn't. She has a kid that isn't.
Exactly.
So, you know, it just depends on your kid's level, meet them where they are. We love that saying in this world.
Meet them where they are.
Meet them where they are. And we will help you do that. I think, what was the other, was this in this section? I feel like, I know I wrote it down. The role of trust is such a big factor in the therapy world. When you're in therapy with someone, if you've ever been in therapy, you know that, but it's even more important with kids.
Yes.
Because the moment they feel like, even if you didn't,
Yeah.
the moment they feel like you have violated that trust, you are gone. They will never, ever speak to you again, okay? Especially teenagers. Little kids so much don't understand that as much, but if they feel like you've done something that they don't like or, you know, that's made them feel a certain way, they will shut down. Now, they'll come in and play with you still because they want to come do the thing and because they're being told to come in. But they'll never again tell you something that could potentially blow back on them, even when they're young. They know better because they've likely been taught about, like, secrets and what we don't share with strangers and what we do. And so then they'll just tell you very benign things like, oh, school is great, or I'm excited about my birthday or Christmas or whatever.
Yeah.
You pick that up very quickly. You're like, what's happening here? So it's very important. I guess I didn't put it on here. The other takeaway was that if you're a parent and your kid's in therapy and they have like attachment issues or whatever, there is like attachment repair therapy that you can do with your therapist and your kid that helps rebuild that, because if your kid has the specific disorder, reactive attachment, they need that to be able to attach to humans again. And some parent training would also help.
Absolutely.
So we're not giving you interventions. We're trying to guide you here and give you some insight on those things. So you can always reach out if you need some help. But I think that's all we have for today, yes? Thanks for listening and watching wherever you're at.
Like, share, and follow.
I'm going to get me some tiny hands and be like, I gotta get me some tiny hands. Thanks for listening. We'll see you on the next one, guys.
Bye.
I want to thank you for tuning into this episode of Holding the Line with Got Your Six, where we are just a bunch of therapists who talk about the shit nobody wants to talk about. We hope you got something useful out of it. Stay tuned for more of our upcoming episodes every other week posted to our YouTube channel, Holding the Line GYS. If you want to help support our podcast, please like this video and subscribe to our channel and share this video with others you think may get something useful out of it. Make sure to follow us on Facebook and Instagram, where we will post useful information, dark humor, and more of the shit nobody wants to talk about. Go forth and do magical shit, everyone.
All right, producer lady, what do you think about tiny human therapy?
I agree with everything Brittany said. I think parents have such a misconception of like what kiddos do when they come into our office. And, yes, we send them out back to the waiting room with, a container of slime, or sometimes with some of my kiddos, 3 containers of slime because they can't just pick one, or they fill it with too much glitter so it doesn't fit all in one container. And so sometimes, they've got glitter still stuck to them no matter how much we try to wash it off. I do think, because I think you asked Brittany about it, but I don't think she fully answered the question. I think trauma work with kids is easier than it is with adults. If I can pop a kid in a sand tray and run the tappers, I'm not sifting through 40 years or 25 years even of memories and crap and whatever. I'm sifting through 6 or 10 or 15. So I think it's very different, and you have to know what you're doing when you're doing it. Tiny human therapy is one of my favorites. I typically, it's one of the ones that makes me roll my eyes, but then a kid comes in and I'm like, we're going to play Uno today.
Because we're on 2 ends of the spectrums, because I have tiny humans. I'm okay without doing tiny human therapy, where you're like, I don't have tiny humans. I'll do tiny human therapy though.
Yeah, no desire to birth or raise tiny humans, but I will play Uno and sand tray with them all day long.
No, thank you. I'm like, I'll take mine to therapy, but I'm good. That's as far as I'm going with it. I'm like, you know what? Y'all both need it. Let's learn some regulation skills. Let's learn coping skills.
I think along that realm too, I noticed that I'm far more chill after tiny human therapy than I am after regular adult therapy. And I think because we have to co-regulate, and so they leave my office and I'm like, everything is great and I just got to play, or I colored, and because I'm co-regulating, right? So I have to be calm and chill in the session, and and I got to hang out and color and play, which was cool. So it speaks to my child parts, which is really nice. So I definitely enjoy that. But
I want to do that with adults more. Let's color today.
Let's color. Can we color more with adults? Grown-ups, can we normalize you showing up to therapy and your therapist being like, would you like to color? I have adult coloring books in my office that have swear words on them. I have a brain coloring book that I love to use. I have a horror, it's got really scary, creepy looking pictures in it that I color. We need to normalize coloring as adults more.
Absolutely. If they want to get in the sand tray, go ahead. Do you think?
Please do. Please do. I have had so many adults. It was funny when Brittany was talking. She was like, my teens are absolutely not, and that is very true. I have yet to have a teenager who will be okay with going in the sand tray. Adults, they're like, I don't, what am I going to do? And I'm like, I don't know, just grab some stuff, or I'll be more directive, right? And I'll say, well, why don't we, reenact the scene from your office that you were telling me about today? And they'll pull out, I have a Grim Reaper with a skull on a staff, and they'll bring that out and be like, this is my boss. I feel like you don't say.
I feel like this would just be so much more. It's instead of telling me about your day, go reenact it.
Go play it out. Yep. And then they're like, wow, this is really cool. And I'm like, you want to color next time? Come in and let's color.
I would get so much more out of that on some days.
Yes. Absolutely, because it's all projective. It goes back to the kids not having a language, and adults sometimes not having a language. Yeah.
On the days that you're just I no words at all.
Yeah. Yes, I've had those days. I still have those days.
So let's normalize tiny human therapy, and then doing tiny human therapy things in adult therapy.
In adult therapy, because you have tiny humans in you still. There are little parts of you that feed. I love inner child work. And they're always surprised. They're like, I'm like, well, how old is this part of you? And they're like, oh my God, I think it's 6. I'm like, oh my God, this goes back to when I was a kid. Because all roads lead to Rome, guys. Play with your therapists.
Absolutely.